Welcome back guys. Now in this video let's discuss about the respiratory reflexes. Okay, we all know reflexes are involuntary in nature. So what are the three important respiratory reflexes which you should know for your exam for sure? The first one is called as the Herring-Breuer inflation reflex. What is that? Herring-Breuer inflation reflex. So what exactly is this Herring-Breuer inflation reflex? Herring-Breuer inflation reflex. See, once your lungs are overstretched, okay, what will happen once your lungs are getting overstretched? Tell me, it's a good time to stop the inspiration, right? We don't want to overstretch the lungs and we don't want to have the rupture of the alveolus. We don't want the lung to get ruptured, affected. So once your lungs are getting overstretched, see, I am doing it voluntarily. I am trying to take as much air as possible. So I am trying to take more the tidal volume, almost 3 times the tidal volume. Okay, normal tidal volume is how much? 500 ml, but I am taking more than it. So when your lungs are trying to get overstretched, when your lungs are getting overstretched, you know what will happen? The stretch receptors in your lungs are activated because your lungs are getting stretched, overstretched. So the stretch receptors in your lungs are activated. Now from the stretch receptor, we all know receptors are attached with what? Receptors are attached with a sensory neuron. So once your lungs are getting overstretched, from the stretch receptors, the vagus nerve which is getting activated. Now the vagus is activated from your lungs. Okay, the vagus is activated from your lungs. Now what do you think this vagus will do? Vagus will take this information to the central nervous system. Lungs are getting overstretched, bad. Now this vagus immediately inhibiting the dorsal respiratory group. Immediately it will inhibit the apneustic center, it will inhibit the dorsal respiratory group. So now dorsal respiratory group stopped. Now tell me, whenever the dorsal respiratory group is stopped, do you think further rise in tidal volume can happen? No. So inspiration immediately ceases, inspiration stops. I have told you, it's the dorsal respiratory group which is responsible for smooth rise in tidal volume. But now the dorsal respiratory group is inhibited. Without dorsal respiratory group, no more ramp signals. Okay, no more ramp signals. No further inspiration. So inspiration stops. So that is good, right? Yes. So whenever inspiration stops, that is preventing the hyperinflation of the lung. Okay, we don't want the hyperinflation of the lung, or we don't want the rupture of the alveolus. So always remember who is going to this Herring-Breuer inflation reflex. Okay, whenever there is hyperinflation of the lungs, so inspiration will automatically stops. So you try to do it. Try to take as much air as possible. At one point of time, see, inspiration is stopping, right? Who is stopping? Even though you voluntarily trying to take the inspiration, someone is stopping it. You can't do the inspiration completely. You can't do it. Okay. So who is stopping it? It's the Herring-Breuer inflation reflex with the help of vagus nerve. So which nerve is involved? Vagus nerve is involved. Remember, who is inhibited? Dorsal respiratory group is getting inhibited. Done. Now after discussing about the Herring-Breuer inflation reflex, now let's see what is Head's paradoxical reflex. Okay, Head's paradoxical reflex, which is a little tricky, but first let me explain you what is normal. Okay, again I am explaining the Herring-Breuer inflation reflex. Look at the first point. See, imagine you are blowing up your lungs, means like a balloon, you are blowing up your lungs. See, normally when your balloons get really full, means like a hyperinflation, what your brain will say? Okay, what your body says? Your body says, man, your lungs are getting hyperinflated, this is not a good thing. So stop inspiration. So your body will say, okay, stop. That's enough air. Body will say, stop. Enough air came. Almost tidal volume has increased by 3 times. This is not good. There is hyperinflation. So Herring-Breuer inflation reflex will come. So that is called, say, Herring-Breuer inflation reflex. You know it. So it tells you to stop breathing when your lungs are full. When your lungs are full, this Herring-Breuer inflation reflex, with the help of the vagus nerve, it will tell you, stop it. Okay, stop it. So that is normal. But what is Head's paradoxical reflex? This is exactly opposite. Okay, exactly opposite. See, sometimes your body does something weird, guys. Okay, see, but sometimes your body does something weird and exactly opposite. That is Head's paradox. Paradox means what? Unusual. What is that? See, when your lungs are getting stretched a lot, means your lungs are getting stretched, overstretched, like during a deep breath. Sometime, okay, doesn't matter. Your lungs are getting overstretched. So instead of stopping, your body has to actually stop it. But instead of stopping, your body say, keep going, take more air. So that is called as Head's paradoxical reflex. Usually, listen, whenever there is a hyperinflation of the lung, your body have to stop it. Your body have to stop the inspiration. But what if your body says, keep going, take as much air as possible? So that is called as a Head's paradoxical reflex. Why it is paradox? Paradox means unusual. No, usually the inspiration should stop with the help of the Herring-Breuer inflation reflex. But sometimes the body is going to say, keep going, take as much air as possible. When? Especially during the first breath, guys. In neonates, this is seen in Head's paradoxical reflex is going to be seen in the neonates. Neonates, their first breath, okay, when the baby born, the baby is going to take the first breath, right? So whenever the baby is breathing, so air is going to the lungs. So that is going to cause the Head's paradoxical reflex. So whenever there is stretching of the lungs, that further facilitates the inspiration, so that there is going to be complete expansion of the lungs. Because you know, in the intrauterine line, the lungs are completely collapsed. You have to take as much air as possible to completely inflate the lungs, to completely inflate the alveolus. So this Head's paradoxical reflex is going to be seen in the neonates. That's why I have kept here neonate. Okay, neonate taking the first breath. Okay, and also seen during the yawning also. Okay, during yawning, what we'll do, we'll take a larger breath, right? We'll take a lot of air. So usually, see, that's the Head's paradoxical reflex. It's like your lung saying, more air please, more air please. Instead of stopping, take more air, completely inflate the lungs. Okay, completely open the lungs. So that is Head's paradoxical reflex. Only what you need to know, it's going to be seen in children and their first breath, and also seen sometimes during the yawning. Okay, yawning. Done. Next step. What is J reflex? Okay, J. The word J stands for juxtapulmonary reflex. Juxtapulmonary. So try to understand what is this juxtapulmonary reflex, guys. Okay, juxtapulmonary receptor reflex. Try to understand. See, here there is a blood vessel, pulmonary capillary, let's say. Here there is a pulmonary capillary. Okay, pulmonary capillary. Surrounding the pulmonary capillaries, there are these J receptors present. These are the J receptors. J stands for juxtapulmonary capillary receptors. So if it is a receptor, definitely it should be sensing something. What it will sense? So it's always sensing if there is any pulmonary congestion or pulmonary edema. So they are always sensing about the pulmonary congestion. Is the blood flow normal or not? Is there any stasis? Is there any pulmonary edema? So these J receptors, okay, okay, what they will do? Whenever there is a pulmonary congestion, let's say pulmonary congestion or pulmonary edema, what do you think will happen? This pulmonary congestion is going to activate these J receptors. So activation of J receptors, what they will do? Once these J receptors are activated, do you know what will happen? The heart rate decreases. There's going to be rapid shallow breathing and there will be hypotension, guys. So this is called a J reflex. What is J reflex? There's going to be mainly bradycardia with a rapid shallow breathing. So why this J reflex is happening? Look at here. Let's go point by point. Imagine your lungs are in trouble, guys. Okay, your lungs are in trouble. Which trouble? They're having pulmonary congestion or let's say pulmonary edema. Okay, full of fluid. There is pulmonary edema, let's say. Like a water-filled sponge. Your lungs are totally with water. Now your body needs more oxygen, yes or no? See, your lungs were not supposed to be with any fluid. Now there is pulmonary congestion or pulmonary edema. So your body is like asking for oxygen. Now whenever there is pulmonary edema, the body is not getting enough amount of oxygen. Okay, but your lungs cannot send enough amount of oxygen to the blood, yes or no? Because there is pulmonary congestion or pulmonary edema, the oxygen delivery to the blood is not happening easily. Now what will happen? See, so your body thinks, now I'm not getting enough amount of oxygen. Your body is thinking, I'm not getting enough amount of oxygen. I must save the energy and protect the important organs. See, first of all, you are having oxygen deficit. Okay, you are having what? Oxygen deficit. Okay, you are not getting enough amount of oxygen. See, in this oxygen crisis, when you are not getting enough amount of oxygen, your body is thinking, please let me save the most important organs like brain and heart. So what your body will do, you know, see, once there is pulmonary congestion, this is what happens. Once there is pulmonary congestion, these J receptors are activated. These J receptors are taking this information from the J receptors, the vagus nerve, from the J receptors, the vagus nerve will take the information to the brain. Now, like there is pulmonary congestion, pulmonary edema is there. So now enough amount of oxygen is not going to go into the blood. So immediately, do you know what will happen? You are going to breathe faster. Okay, two things will happen. You are going to breathe faster. Why? To get more air. Okay, to get more air or to get more oxygen. So to try to get more oxygen from the lungs. So you are going to do rapid breathing to get as much air as possible. Okay. Next, what will happen? You are going to slow down your heart rate. Okay, you are going to slow down your heart. Why? Why you are slowing down your heart? Because you are not getting enough amount of oxygen, right? If your heart is beating fast, more blood will go to the tissues. Your tissues will take up more and more oxygen. So you are slowing down your heart means bradycardia. Why there is bradycardia? See, so your body uses less oxygen. Bradycardia means you are sending less oxygen to the, you are sending less blood to the tissues. So your tissues will use less oxygen, so that the oxygen will be taken by the brain. If the heart pumps slower, see, if the heart pumps slower, it gives more time for the blood. See, now the blood is going slowly through the lungs. Now there is more time for the blood, there is more time for the RBCs to pick up more oxygen from the lungs. So what your body is trying to do, see, whenever there is pulmonary congestion, I am talking about, see, whenever there is pulmonary congestion, these J receptors are activated. Now these J receptors, once they are activated, do you know what they will do? These J receptors, with the help of the vagus nerve, see, with the help of, let's say, vagus nerve, they are giving this information to the central nervous system that there is pulmonary congestion. Now your central nervous system will understand, and what it will do, the central nervous system is going to, in response, it is going to increase the respiration. Okay, you are going to have the shallow rapid breathing, and the central nervous system is going to decrease the sympathetic activity and trying to decrease the heart rate. There is going to be bradycardia. So now you understand what is the J reflex. So J reflex means whenever there is pulmonary congestion or pulmonary edema, the J receptors are activated, and these J receptors, with the help of the vagus nerve, giving the information to the brain that decrease the heart rate, increase the respiratory rate. Okay, this is called as a J reflex, a juxta pulmonary reflex, which was discovered by an Indian scientist from the prestigious AIIMS Institute. Okay, so with this, the three important reflexes completed. What are the three important reflexes? Again repeating. First one is called as the Hering-Breuer inflation reflex. Hering-Breuer inflation reflex is like, once the lungs are overstretched, inspiration stops. Okay, enough amount of air, stop the inspiration. Next, what is Head's paradoxical reflex? Paradox means unusual, opposite. What is the Head's paradoxical reflex? It is the inflation of the lungs. It is the inflation of the lungs going to facilitate the further inflation. Okay, inspiration is going to further, it's going to increase the further inspiration. Okay, causing the hyperinflation of the lungs. That's the Head's paradoxical reflex, which is going to be seen with the newborn in their first breath, and also seen during the anning. And what is the J reflex? What is happening? What is the end result of the J reflex? End result of the J reflex is hypotension with bradycardia and rapid shallow breathing. Okay, it's going to be seen during the conditions of pulmonary congestion and pulmonary edema. Okay, so with this, the three important pulmonary reflexes are completed. Hope the video is helpful. Thank you.